In this video, we are going to learn about clavicle. Clavicle, also known as collarbone, is a modified long bone. It is situated in front of root of the neck. You can see it is situated in front of root of the neck. It connects upper limb with the trunk. Functions of clavicle. Weight transmission. Clavicle transmits the weight of upper limb to axial skeleton through coracoclavicular ligament. It transmits weight of the upper limb to the axial skeleton through coracoclavicular ligament. Coracoclavicular ligament is present between coracoid process of scapula and clavicle. Strut function. It acts as strut that keeps upper limb away from the trunk or body to make upper limb move freely. It acts as strut that keeps upper limb away from the body to make upper limb move freely. Peculiarities of the clavicle. It is the only long bone that lies horizontally. It is the only long bone that lies horizontally. It is subcutaneous throughout. It is the first bone to start ossifying and last bone to complete its ossification. It is the first bone to start ossifying. It starts ossifying from 5th to 6th week of intrauterine life and it completes its ossification at 25 years. It is the first bone to start ossifying and last bone to complete its ossification. It is the only long bone which ossifies in membrane. It is the only long bone that ossifies in membrane. It is the only long bone which has two primary centers of ossification. You can see here there are two primary centers. It is the only long bone that ossify by two primary centers. It has no medullary cavity. It is occasionally pierced by middle supraclavicular nerve. It is the cutaneous nerve. Features of clavicle. It has shaft and two ends, medial and lateral ends. Medial and lateral end. Now let's see about ends. Two ends, medial end and lateral end. Medial end is also known as sternal end. It is quadrangular. It is enlarged quadrangular. Articulation. It articulates with clavicular notch of manubrium sterni to form sternoclavicular joint. Sternum has three parts: manubrium sterni, body, xiphoid process. This is manubrium. This is clavicle. Medial end of clavicle articulates with clavicular notch of manubrium sterni. We can see here the medial end of the clavicle articulates with clavicular notch of manubrium sterni. The medial end of clavicle articulates with clavicular notch of manubrium sterni to form sternoclavicular joint. Sternum clavicle. Sternoclavicular joint. Attachments. Fibrous capsule of sternoclavicular joint. Around the joint there is capsule. As this is sternoclavicular joint, capsule of sternoclavicular joint. Intra-articular disc. Interclavicular ligament. Capsule of sternoclavicular joint. Intra-articular disc. Interclavicular ligament. The medial end is enlarged and quadrangular. It articulates with clavicular notch of manubrium sterni to form sternoclavicular joint. Lateral end or acromial end. Lateral end is also known as acromial end. It is flat from above downwards. It has small oval articular facet. Articulation. It articulates with acromion process of scapula to form acromioclavicular joint. You can see here, this is the lateral end of the clavicle. It articulates with acromion process of scapula to form acromioclavicular joint. This is dorsal aspect of the scapula, acromion process. The lateral end of clavicle articulating with acromion process to form acromioclavicular joint. You can also see here, this is scapula, this is coracoid process of scapula, this is acromion process of scapula. The lateral end of the clavicle articulates with acromion process of the scapula to form acromioclavicular joint. Acromion process, clavicle. Acromioclavicular joint. Lateral end, it is flat from above downwards. It articulates with acromion process of scapula to form acromioclavicular joint. Attachments. Capsule of acromioclavicular joint. Medial end is quadrangular. It articulates with clavicular notch of manubrium sterni to form sternoclavicular joint. The lateral end is flat from above downwards. It articulates with the acromion process of scapula to form acromioclavicular joint. Attachments of medial end, capsule of sternoclavicular joint, intra-articular disc, interclavicular ligament. Attachments of lateral end, capsule of acromioclavicular joint. Shaft. It is divided into two parts, medial 2/3 and lateral 1/3. The shaft is divided into medial 2/3 and lateral 1/3. First, let's see about medial 2/3 of the shaft. It is rounded. It has four surfaces. There are no borders. Anterior surface, posterior surface, superior surface, inferior surface. Medial 2/3. It is rounded. It has four surfaces. Anterior surface, posterior surface, superior surface, and inferior surface. Anterior surface, it is convex forwards. Attachments. Clavicular head of pectoralis major muscle origin. Pectoralis major origin. This is medial 2/3. The anterior surface of medial 2/3 is convex forwards. It gives origin to clavicular head of pectoralis major. Pectoralis major, it has two heads. One is clavicular head and the other is sternocostal head. Pectoralis major has clavicular head, sternocostal head. Clavicular head of pectoralis major arises from anterior surface of medial 2/3 of the shaft. Posterior surface, it is concave. Attachments, sternohyoid muscle origin. Relations, it is related to brachiocephalic vein formation. Brachiocephalic vein is formed by the union of subclavian vein and internal jugular vein. Brachial plexus, subclavian artery third part. You can see here the posterior surface of medial 2/3 of shaft is concave. Posterior surface of medial 2/3 of the shaft near its medial end gives origin to sternohyoid. You can see here this is manubrium sterni. Posterior surface of medial 2/3 of the shaft near its medial end gives origin to sternohyoid. The posterior surface is related to brachiocephalic vein formation, brachial plexus, subclavian artery third part. Superior surface, its medial part is rough, its lateral part is smooth. Medial part rough, lateral part smooth. Attachments, clavicular head of sternocleidomastoid muscle origin. Superior surface gives origin to clavicular head of sternocleidomastoid. You can see the sternocleidomastoid. It has sternal head, clavicular head. Sternal head arising from anterior surface of manubrium sterni. The clavicular head arising from superior surface of medial 2/3 of the shaft. Inferior surface, at its medial end, it has rough oval impression. On the lateral part, it presents subclavian groove. At its medial end, it presents rough oval impression. On lateral part, it presents subclavian groove. At the lateral end of subclavian groove, there is nutrient foramen, which transmits suprascapular artery branch, which is directed away from the sternal end. The inferior surface at its medial end, it has rough oval impression. On the lateral part, it presents subclavian groove. At the lateral end of the subclavian groove, there is nutrient foramen. Through this nutrient foramen, a branch of suprascapular artery passes, which is directed away from the sternal end. Attachments, costoclavicular ligament, subclavius, clavipectoral fascia. The attachments of inferior surface, subclavius muscle. Subclavius muscle is inserted onto subclavian groove, which is present on the inferior surface. On inferior surface of medial 2/3 of the shaft of the clavicle, there is subclavian groove. To the margins of subclavian groove, clavipectoral fascia is attached. On the medial side of inferior surface, there is costoclavicular ligament between the first rib and clavicle. Rib, costo, clavicle. Costoclavicular ligament. Anterior surface, it is convex forwards. Posterior surface, it is concave. Superior surface, in its medial part, it is smooth. In its lateral part, it is rough. Inferior surface, in its lateral part, it presents subclavian groove. At the lateral end of the subclavian groove, there is nutrient foramen. You can see the nutrient foramen here. It is present at the lateral end of the subclavian groove. Now let's see lateral one third of the shaft. It is flat. It has two borders and two surfaces. Two borders, anterior border, posterior border. Two surfaces, superior surface, inferior surface. Anterior border, it is concave forwards. Attachments, deltoid muscle origin. Posterior border, it is convex backwards. Attachment, trapezius muscle insertion. Lateral one third of the shaft has anterior border concave, posterior border convex. Anterior border gives origin to deltoid, posterior border gives insertion to trapezius. This is deltoid. The anterior fibers of deltoid arising from anterior border of lateral one third of the clavicle. You can see here, this is trapezius. It arises from skull and spine, and it is getting inserted here. It is getting inserted onto posterior border of lateral one third of shaft of the clavicle. Two surfaces, superior surface, inferior surface. Superior surface is subcutaneous. It is rough in anterior and posterior parts, and it is smooth in middle part. Inferior surface, it presents conoid tubercle and trapezoid ridge. Attachment, corococlavicular ligament. On the inferior surface of lateral one third of the clavicle, there is conoid tubercle, trapezoid ridge. To the conoid tubercle, conoid part of corococlavicular ligament is attached. To the trapezoid ridge, trapezoid part of corococlavicular ligament is attached. Between the coracoid process of scapula and the clavicle, corococlavicular ligament. Coracoid process clavicle, corococlavicular ligament. This corococlavicular ligament has two parts, conoid part, trapezoid part. Conoid part is attached to conoid tubercle. Trapezoid part is attached to trapezoid ridge of the clavicle. Lateral one third of the shaft. It is flat from above downwards. It has two borders, two surfaces. Borders. Anterior border, posterior border. Anterior border, it is concave forwards. Posterior border, it is convex. Surfaces, superior surface and inferior surface. Superior surface, it is rough in anterior and posterior parts and smooth in its middle part. Inferior surface, it presents conoid tubercle and trapezoid ridge. Anatomical position of the clavicle. The clavicle should be placed in such a way that enlarged quadrangular end lies medially, flattened end lies laterally. The shaft is curved. It should be held in such a way that its medial two-third is convex forwards, its lateral one-third is concave forwards. The inferior surface is grooved longitudinally in its middle one-third. Ossification. Clavicle is the first bone in the body to ossify. It has membranocartilaginous ossification. Most of the bone ossifies in membrane, except its medial end that ossifies in cartilage. Most of the bone ossifies in the membrane, except its medial end. Medial end ossifies in cartilage. Ossification centers. There are two primary centers for shaft and one secondary center for the medial end. Two primary centers for the shaft appear by 5th to 6th week of intrauterine life and they fuse by 45th day. One secondary center for medial end appears by 15 to 17 years and it fuses with the body by 21 to 22nd year. Clinical correlation. Fracture of the clavicle. Clavicle is commonly fractured by falling on outstretched hand. Common site of fracture is at the junction of medial two-third and lateral one-third of the shaft of the clavicle. Displacements of the fractured fragments. Medial fragment is elevated due to sternocleidomastoid muscle. Lateral fragment is displaced downward due to weight of the limb. Due to weight of limb, lateral fragment is displaced downwards. Due to action of sternocleidomastoid, the medial fragment is elevated. Diagnosis: radiological examination by the X-ray. Treatment: non-surgical, surgical. Non-surgical: most of the cases are treated with figure of 8 splint with immobilization of upper limb. This is figure of 8 splint, figure of 8 splint brace with immobilization of upper limb. Surgical: the surgical treatment is based on severity of fracture or complications. It involves plate and screw fixation or fixation of intramedullary nail. Cleidocranial dysostosis. It is a birth defect that has improperly developed or absence of clavicles. Improperly developed or absent. It is associated with anomalies of skull and teeth. In this condition, the shoulders are approximated anteriorly in front of the chest. It is associated with skull and teeth anomalies. Clavicles are improperly developed or absent. The shoulders are approximated anteriorly in front of the chest.